Hi, I'm Chris Voss. I'm sure it comes as no surprise to you that not everybody who comes into a disaster resource center will be healthy. You will see people with immediate medical needs. You'll also see people with ongoing day-to-day medical issues. You have to get creative to help certain problems. But the good news is that nobody is asking you to be a doctor. There are resources out there to help you. Today, you'll hear from two of the region's top experts on supporting health needs during a disaster. Aaron Monig of the Multnomah County Health Department and Wade Fee of the Washington County Medical Reserve Corps. They've been helping people for a combined 40 years. What they have to share with you today is going to help you support the medical needs of guests in the Disaster Resource Center. Thank you for taking the time to learn these new skills before disaster strikes. Don't forget, this is part of a series all about operating disaster resource centers, and we have lots of other topics you're welcome to check out. Okay, let's hear from the medical experts.
Hi, I'm Aaron Monig, and welcome to my office. I'm here to help you feel as confident as possible managing chronic health and medical issues that will come up in your work at a disaster resource center. First, let's just define a few terms. Chronic issues are ones that people more or less live with day to day, like severe diabetes or high blood pressure. Acute issues, on the other hand, have come up just now and need more attention. Things like chest pain and shortness of breath, things suggestive of a heart attack. Then triage is the process of looking at and listening to a person to figure out how urgent their medical need is. What you'll see in this segment is that the only triage you really need to do is to figure out if it's a chronic or an acute issue, and when necessary to link those people to a practitioner who can help them.
Hi, I'm Wade Fee. Okay, so first, what's our goal with chronic health issues in the DRC? We're not a hospital, but we're there to support the safety and well-being of the people who need us. Well, our goal is not to fix chronic medical needs. Our goal is to determine what we need to do so people can safely stay in the Disaster Resource Center for as long as they need to be there. The fact is that a lot of people live every day with chronic health issues. They might look really sick to you, but that doesn't necessarily mean that they need to be rushed off to the hospital, because that's not going to fix their chronic health issue. But you shouldn't have to worry about this decision on your own. Ideally, a licensed medical practitioner should be on site during the first shift as people are arriving. That could be an EMT, a paramedic, a nurse practitioner, a physician's assistant, or maybe an actual physician. We like to position that person at the front door or reception so they can see each person as they come in. At the very least, they'll be able to do passive triage as people come in and make sure that everybody can safely stay in our DRC. If someone is having an acute health issue, then the medical practitioner will help triage them and get the acutely ill people into the medical system. However, the people with chronic illnesses are probably going to be sticking around, and they may need certain accommodations or adjustments. I try to ask myself a few questions about what we can do for them. Do they need oxygen? Do they need a special bed? Do they need a special piece of equipment? Do I need to find a special place for them in our facility?
Sometimes we need to get creative to meet people's needs, especially when our resources are already spread thin. One time this came up was when someone who weighed 600 pounds came into the DRC and needed a place to stay. This person couldn't lay down flat or they'd stop breathing. Our standard shelter equipment did include some bariatric cots, but those ones lay flat. The staff put in a request to the EOC for a bariatric bed, one that we could put up at an angle so they could sit upright. There aren't many available in the whole city, so while the EOC was working on that request, the staff got creative and found a way to accommodate the person in the DRC. They used the blankets and pillows and the bariatric cot that they already had to find a way to sit them upright and accommodate them. We do our best to get the medical equipment that they need and request, and if we can't find it, we work with what we have. Some people will just tell you right off the bat what they need for their health problem. This can result in some unique resource requests. Usually we want to be very general with what we ask from the EOC, so they can also be creative with what they have available. But self-identified needs and medical equipment requests are one of the few times you can submit a resource request to the EOC with the exact specifications. For example, someone shows up and needs catheterization. They can do it by themselves, but they don't have the equipment they need. So in this case, you'd put in a resource request saying, we need this exact specific thing for this person. Now, I've heard people in the DRC say they're extra susceptible to infection, and they should be in an isolated area. Remember, we don't decide their needs, they do, and we'll always accommodate to the best of our ability.
If people come in and self-identify that they have a contagious illness, some decisions will have to be made. Is this a 911 call? Should we go to the hospital? Can they follow up with the doctor tomorrow? Can we find a location that helps minimize contact with others? Should we give our hotel voucher to this one sick person so that everyone else here doesn't end up sick? There are constant decisions to be made based on best judgment, equity, and available resources. This is a time to notify your supervisor and EOC, and they'll take it from there. Sometimes you might feel overwhelmed by the number of people with chronic medical needs. That's okay, it's normal. I've definitely been there. Just put in a resource request to the EOC for medical help. And it's okay if you don't know exactly what help you need. You just need to recognize when there's a gap. What you get from the EOC depends upon what the need is and what resources are available. People living with HIV may need certain medications, and transgendered people may also need hormone medications. You may need to link people to available medical resources or to your DRC coordinator.
Of course, we hope people are not using illegal drugs in the DRC, but in reality, they may be. So one specific question that often comes up is, what do we do in case of an opioid overdose? Or do we have Narcan? Narcan's a medication that blocks the effect of opioids, especially in overdoses. So the answer is, just-in-time training and the supply of Narcan might be available, and you can check with your supervisor to find out if you have them at your DRC.
All right, so that's it for today. If you don't remember anything else from today, just remember that we welcome everybody at our disaster resource centers. You'll be paying attention to the difference between people's acute and chronic health issues, and medical practitioners can help triage. You can submit a resource request to the EOC for medical support if you need it, like if people are coming and you don't have any medical personnel there yet. And finally, people with chronic health issues may need accommodations in order for them to safely stay at the Disaster Resource Center. So we always accommodate to the best of our ability by making a resource request or getting creative. But we don't decide their needs, they do. So don't forget that we have a whole series of training all about operating a DRC. And you're welcome to check out our other topics as well. Thanks for watching.